First off, this is a physical trauma lab, and physical trauma, we are going to use the closest thing we have to human tissue. This is pork. This particular piece is pork belly. Okay, now, we got two different types of trauma. We got blunt force trauma, and we got sharp force trauma. What do you think the difference is between the two? Blunt force trauma and sharp force trauma. What do you think the difference is between the two of those? Well, it's literally what's causing the damage. Okay, if it's something blunt, it's going to be a dull item, and it's going to have, not a sharp edge to it. So things like cars, generally considered blunt force trauma if you get hit by a car. A baseball bat, blunt force trauma. Now, the first one we're going to do is the simplest one that there is. Let me find it. Actually, I'll just get another one. Okay, we're going to cause blunt force trauma with a cookie cutter. Okay, now, who in here has fallen off their bike at some point, scraped their knee, their foot, their leg? Okay, or maybe you slid into home base and you've scraped yourself. Okay, so this is the first type of blunt force trauma, and this is referred to as an abrasion or a brush abrasion. And all we're doing here is I've got a rough surface, and I'm dragging it. Now, it doesn't look super impressive, but what have I taken off? That is a top layer of skin and fatty tissue. Okay, and so that's what the first one of these is basically a brush abrasion. You're brushing up against a surface, and you are going to go ahead and basically remove tissues. And when you hit that white area, you're going to keep hitting it until you can see the pink. Keep going. Okay, let's scoot that back. All right. Right there. Keep going. Okay. Keep going. Okay, that's good.
Sorry.
Oh, it's okay. So just a little pork fat in the eye. Okay, now. Take a shower when I go home later. Okay, now. Oh, left. Oh. All right, awesome. What are you doing? Okay. All right, so as you can see, guys, this would be an example of a laceration. Basically, it's crushing and tearing the tissue. This is not super perfect. Let me see if I can get a couple more quick hits in. Okay, there we go. There we got some tearing on the tissue. Okay, so this is going to be your laceration. This one, guys, is going to be the first one that y'all are going to do. Okay, and this is going to be the impact abrasion. Now, for the impact abrasion, it's literally hitting something hard. So who wants to be my person that's going to beat the hell out of this pork belly? By the way, this is the closest thing you're going to get to human stomach tissue. Do you want to go first, John? Okay, so John, you have a couple of options today. By the way, everything that's covered in plastic basically just means I don't want it permanently smelling like weird pork. Okay, so this is an Indian ball club. Okay, we're not going to use the knuckles yet. That's later. And we also have a lead sap, which is basically lead covered in leather, and it's got a little bit of a give to it. So what are you in the mood for today? The ball club? All right, so all you're going to do is we're going to do like a 5 count of 5 seconds, and you are just going to beat the hell out of that with the ball end. Okay, that's the end that goes into that. All right, so let's go ahead and get started. On, go. 1, 2, 3, 4, 5. All right, stop. All right, thank you. All right, so guys, this is an example of an impact, basically an impact abrasion, or also referred to as basically just impact trauma. Now, this is not yet ripping the tissue, but I can feel it on the other side, and it's already starting to rip the tissue internally on this. Okay? So, even though it's a weapon that literally predates the tomahawks and edged weapons in the United States, and even predates the United States, could this do some pretty serious damage? Okay, now imagine what would happen if you hit somebody in the ribs with it. Because we have some ribs. We're going to ask you to hit them. Okay? So come on up. Okay, you're going to do the same thing, and you're going to try and break this poor piggy's ribs. Five hits. Go. One more. There you go. Okay, so we definitely have an impact abrasion here, guys. We've got some broken ribs in here. I can feel the break, like literally right here. If I pull it out, I can pull out part of the rib that he broke off. Okay, so that is your impact abrasion. Now, as far as how much damage you can actually do, is you need to understand something. When you cut somebody like that, you're to their bone. Okay? Now, let's move into the chop. Okay, and the chop is the highest energy one that you're going to have. I need to do that one. You want to do the chop? Yeah. Okay. So let me kind of rearrange this a little bit here. So why would people get stabbed? They like twisted. Okay, well, let's demonstrate. Actually, let me put this one up here on top since this one's got some tissue still. Okay, so here's the thing. When people stab other people, you got two different methods they do. They either go this way, okay, and if they're going this way, which I can't really do here because it's lying down, and this is basically a forward stab. You're going to be going into the main body. Now, if you're twisting it, okay, first off, no one does that on purpose unless they're trained to do that. Okay, all you're going to be doing is making a bigger wound cavity. So you're going to basically be making a bigger hole. So if I stab in here and I twist, I can basically take that wound cavity and I can make it big enough to fit my two fingers through it. Okay, and that's the big thing you need to understand. So that's always one of those things. Now, the other part that we see is we see what's called the standard ice pick grip. And an ice pick grip is literally overhand like this. Okay? Right, now, as we move into a chop wound's going to be a little bit more deadly, a little bit more impressive in some ways. So, with the chop wound, I'll let you choose if you want to use the axe or you want to use the machete.
Let me see.
This is the machete, and I made that one. And this is an axe. The axe is always impressive.
I want that one.
Okay, come on up. All right, I'm going to move some of this stuff out of the way. This one tends to bounce on the table a lot more.
This heavy.
Well, the entire idea behind it, yeah, it's going to be a little, well, you might want to get a glove on, but you know, whatever. Yeah, this one I'm not super worried about since this is not a display piece. This goes in my truck most of the time, or goes in my car. You really, because of the weight of it, you kind of need to put a little effort into it. I mean, it's going to come down pretty solidly because of the weight to it, and that's why axes are still in use today. Is because that you should be able to go in, just see what the weight looks like, just have it what's called a gravity drop. So just kind of drop it, but don't try to force it just to see what it looks like at first. Okay, now go ahead and give it a good swipe, good hit.
What you mean? With one hand?
Two hands. Okay, just hit it once.
I'm scared.
That's okay. Here, there we go. Good, that's exactly what we want. This is why we stack it up. She's actually gone into, that's part of the cut, that's part of the cut, and part of the cut down there. A chop wound, please don't do it while I'm next to you.
Oh, I thought you were far, sorry.
Okay. Okay, let me just take that for a second. Oh no, you can do it in a second, again. Okay, but here's the thing, guys.
I don't do it no more.
It's fine.
We've all,
okay. Okay, chop wounds do a lot of damage, all right, so come on up. One of y'all said you wanted it. Okay, now the big reason we stack it up on here, guys, is because if we don't, we will literally cut through the cutting board. I don't know, were you there for the cutting board cut? Okay, so the first demo I ever did with an axe, we literally split the cutting board in half and it went flying off the table. So, which is why we, yeah, yeah. Of course, it was also during COVID, so everything was a little crazy. So, go ahead and give it a little hit. Okay, let me put this back on. Let's not be swinging.
Oh, don't.
Okay, now you can swing again.
Now I can go?
Yes. Okay, just the amount of damage. Now remember, the axe, oh, you can keep holding it, just don't swing it. The axe and the sword, or the axe was a standard weapon of medieval warfare. So imagine getting this wound in the time before antiseptic and modern medical treatment. You gonna be living long after that? No. All right, probably not. Okay, so we're gonna go ahead and add one more layer of fun. And these are ribs, okay? And then we're gonna do, so all I want you to do is I want you to hit it as hard as you can. We're gonna see if we break through the ribs. Okay, go ahead and pull it out. All right, we broke through the ribs. And so this is gonna be our next one right here. And you can actually see it. So if y'all come over here, you can take a closer look at it. Let me find the bone one. Nope, 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 nope. There we go, bone fractures. Okay, so here's your bone fracture. And bone fracture in this case is we broke through the bone tissue, and this is the only place that blood is still apparent inside the body. Okay, at this point, is the blood that is inside the bones and the bone marrow. So we have one other one that I'm gonna actually have one of y'all do. Let me find it. No, can't do that. We're gonna do a simulation of an amputation. Okay, now amputation, what is that mostly going to affect? What gets amputated, guys? Legs, hands, fingers. If you know Mr. Oob, Mr. Oob has a finger that's been amputated. How that finger got amputated, I have no idea.
Oh, you got stuck in a oil rig and it twisted and...
Wow, okay, that's terrifying. Okay, so I mean, that could have also been the case. Okay, so what we're going to do is we're going to kind of make this a little bit like a nice, thick, meaty thigh. Okay, man, stuff's getting jacked up pretty badly here. I don't like you. You're too messed up. Get you. All right, so I need someone to come through, and you are going to cut this leg off. All right, come on. Okay, now here's the thing. With this, you're going to basically try to do one swack through it. And if it doesn't go, you're just going to keep sawing through it. Okay, and this is literally how amputations worked in the Civil War time period. So one hit, right there, okay? Now keep sawing back and forth. Keep going until it's all the way through. Okay, oh, got that one piece, lift it up. Okay, keep going.
My bad.
Oh, no, you're good. Okay, that's essentially what an amputation is, guys. It's a full removal of tissue from itself. Like you have fully cleaned the tissue off. Now, how long do you think it takes to actually amputate a real leg with a bone in it?
Long time. No. Maybe an hour. Less. Longer. I don't know. 5 minutes. 15.
If it takes longer than a minute, you're probably going to cause the person to die from extreme shock. During Civil War, before antiseptic, the best known case was there was a doctor who could literally get through a leg in about 15 seconds.
So how do you do it like without, you just chop it off with an axe?
Well, you can do that. The problem is it's the bone, okay? And so with that, you would actually have to get a clean cut. And so there's two different ways you can do it. One, you can either kind of maneuver around the bone if the bone's there. So if I've got this ribs, wherever the ribs went to. Ribs, somewhere. Oh, okay, there we go. Okay, so you can either maneuver around the bone, okay, and so that's what I just did there. I maneuvered around it. I wasn't trying to cut through it. Or you can take it to the joint. Now, what's going to happen? A lot of it just really depends on how fast how fast it was going in Civil War times. The problem is if you hit something with a bone and you hit it with something like this, what do you think is also going to happen to the bone? it could possibly shatter. And that's the other problem. If it shatters, the body will not push bone pieces out because the body recognizes it, and it'll just keep them in there, and you're going to basically die from sepsis or one of the other associated things. So they always prefer to use a saw because a saw was a cleaner cut. And if you do it properly, it shouldn't take very long. Modern techniques are a little bit different than the Civil War technique because you're not just going to sit there and slice through like with a chainsaw or anything like that.
So amputate the finger should take like 2 seconds.
If we have to amputate your finger for real, it should not take very long. Almost every case of amputation I know about, though, particularly for fingers, is accidents. So my buddy Jamie put his finger into the skill saw by accident, okay, which is a really rough cut blade, and he just blew the tip of his finger off.
My grandpa had to get his finger amputated because he had an infection in his nail or something like that.
Okay, so that would definitely be a different situation. I don't know how long a surgical amputation would take for a finger because everything I've dealt with has been accidental amputations. So, but it shouldn't take super long. The problem is the longer it takes, the more the person's going to get worked up, and also you're going to have nerve injuries or nerve wounds for some time afterwards. I had a associate of mine recently had his leg amputated after an infection that was a side effect of Gulf War syndrome and some effects. And let's see, I guess he still feels the phantom limb pain, and it's been about a year and a half now. So he still feels his leg there even though it's not there.